1 in 3 adults have some type of alcohol use disorder. If you think about it, alcohol is a huge part of our American culture and day-to-day life. We drink at sports games, at social events, gatherings, celebrations, holidays. And some of us may drink a little more than we should. But how much is really too much? And at what point is it unsafe for your health? All questions I'll be answering in today's episode, coming up. If it's your first time here, I'm Dr. Majd. Consider subscribing to this channel for up-to-date medical topics, news, and headlines. Before I start, note that there is absolutely no judgment on my part here. I mean, hey, I enjoy my glass of red wine too, believe me. What I am presenting here is truly only for informational purposes. If I help even one person figure it out, then I've done my job. I thought it would be an opportune time to discuss this topic since according to a new large study just published January of 2020, the number of people who died from alcohol-related problems each year has more than doubled from 1999 to 2017. The National Institute on Alcohol Abuse and Alcoholism, which is a branch of the NIH, analyzed death certificates and counted 35,000 deaths in 1999, which had risen to 72,000 annually by 2017. The largest increase in death was among women, interestingly, but men still died at a higher rate than women overall. American Indians and Alaskan natives were also at higher risk of dying. And these numbers are probably underestimated since death certificates may actually fail to capture the actual cause of death. And it's really up to the doctor to decide what the actual cause of death may have been. And often this may be a primary care doctor who was not present in the hospital when the patient died. So they have to take a best guess as to what the cause of death would have been after reviewing the hospital records. So this number is likely underreported. The point is that we are drinking more and are dying from alcohol-related complications more as a result, even if we're not alcoholics per se. The way we are reviewing alcohol disorders in medicine is really evolving. More and more people who drink may not meet full criteria for a full alcohol disorder diagnosis, meaning that most of these people who are dying are not exactly alcoholics in the same way that we've viewed alcoholism in the past. There are more people in the gray area now than ever before. There apparently really are now 50 shades of gray. Think of those who binge drink but may not necessarily drink every day, or the stressed out parent who drinks a bottle of wine to drown out the daily whining of the kids, no pun intended, or using alcohol to wind down after coming home from a stressful job each night. Now, this could mean you, even if you're not necessarily an alcoholic. Note that half of the cases of death reported in this large study were due to liver disease, or overdose from the alcohol, or mixing the alcohol with the other drugs. But here are some of the other known health risks of alcohol that you should also be aware of. Acid reflux, stomach bleeds, pancreatitis, cardiac complications like heart failure and atrial fibrillation, cancer, meaning breast, mouth, esophagus, stomach, liver, hypertension, peripheral neuropathy, which is like the tingling and numbness in your fingertips or bottom of your feet, infection, weight gain, sleep disturbance, that's a big one. Relationship, legal, social problems, exacerbations of depression and mental health disorders, memory lapses, and accidents. Think car accidents, falls, fractures. They happen more frequently in people who drink. So how much alcohol is safe? At what point can it cause those complications? Well, based on research and data, in order to prevent risk to your health, the same expert group recommends the following limits. For men under age 65, no more than 14 drinks a week and no more than 4 drinks in a day. And for women and all adults, whether male or female, age 65 or older, no more than 7 drinks a week and no more than 3 drinks in one day. Note that this may actually differ depending on other factors such as your age, body size, medical problems, medications you may be taking. So always consult your doctor for more personalized information. Also note that this does not pertain to pregnant women, children, or teens. No amount is deemed safe here. Now, A drink doesn't mean an entire bottle of vodka, sorry. Before you pour that bottle of red wine to fill your wine glass designed for giants to the rim, some of them are seriously huge, have you noticed? Note that the standard drink refers to 14 grams of ethanol. So this often equates to 5 ounces of wine, 12 ounces of beer, and 1.5 ounce shot of liquor. Now, before you rush to the nearest rehab, certain criteria must be met, such as the following. Recurrent drinking resulting in failure to fulfill role obligations. So think your family life or your functioning while at work. Recurrent drinking in hazardous situations. Think driving or drinking with people that you don't know and in unsafe environments. Continued drinking despite alcohol-related social or interpersonal problems. Think arguments with your spouse or mistreating your children or your loved ones when you didn't mean to. Evidence of tolerance, that 2 shots of tequila are no longer having the same effect and now you need 3, and then later on in time you're going to need 4. Evidence of alcohol withdrawal or use of alcohol for relief or for avoidance of that withdrawal. You know you're going to withdraw, so you take another drink. Drinking in larger amounts or over longer periods than intended. Persistent desire or unsuccessful attempts to stop or reduce drinking. Just know that you can do it. It just may take a few trials. Significant amount of time spent obtaining, using, or recovering from the alcohol or the drinking. Important activities given up or reduced because of the drinking. So like let's say you stopped attending your kids' sports games, or you no longer can enjoy reading books in the evenings because you've passed out. Continued drinking despite knowledge of physical or psychological problems caused by alcohol. It's interfering with your sleep each night or causing you to be depressed, but you just can't stop. Alcohol cravings. You yearn and crave that glass of wine as soon as you get home from work in the evenings. The severity of the diagnosis can be specified based on how many of these criteria are actually met. So a mild disorder is defined by meeting 2 to 3 of those criteria. Moderate is 4 to 5, and severe is 6 or more. Okay, so now you can go run to the nearest rehab. Just kidding. Okay, that's not a good joke. In all seriousness, if you think you have an alcohol use disorder and you need help recovering, or you know someone that needs help, you can call 1-800-662-HELP. This is a free, confidential, 365 days a year hotline. I'll place a link to a few more resources and phone numbers down in the description below. If you found this information valuable, which is always my goal, please subscribe, ring that bell, like, and then consider sharing it with someone else who may find this video useful. Thanks for tuning in. Stay healthy, and I'll catch you next time.